it's time to take a look at stories making the headlines in Nigerian newspapers. I have with me in the studio in-house analyst Obaniyi Akinwale. Good morning. Thank you for joining us at TVC Breakfast. All right, we head straight to the papers now, and I begin with the News Direct. COVID-19, federal government releases 200 billion naira to boost power supply, NNPC. And to the front page of the Leadership newspaper, coronavirus, President Muhammadu Buhari gives presidential task force marching orders to halt spread. And on the front page of the blueprint, lockdown palliatives, states to take charge of distribution, federal government. On the front page of the Daily Trust, Lassa fever killing Nigerians more than COVID-19. 188 citizens died in 3 months. 963 cases in 27 states. Disease deserves more attention. And then we have infographics of how the fever is spreading since 2017 till date. And finally, on the front page of the Daily Times, COVID-19, we can now test 3,000 persons daily, NCDC declares. All right, Obaniyi, I'd like for us to quickly look at the story on the Leadership newspapers, although the stories on almost all the papers are talking about COVID-19, and so we might be merging some of the stories. We'll start from Leadership newspaper, the president giving the task force marching orders to halt the spread. As at this morning, we have 407 cases recorded. The cases keep increasing on a daily basis, and the government has put in so much effort. There is a lockdown in place and all the measures talking about social distancing and the likes. Yet we are still seeing these cases, and the president is saying something has to be done. We have to halt the spread.
Yeah, I want to look at it from the two both local and international perspective. When Melinda Gates Foundation comes out to say they are afraid of what would be the impact of corona in Africa, and you see a lot of our colleagues going online and start shouting, Africa will not die, Africa will not do this. And you recall vividly that during one of the press conferences by Professor Akinwale, Commissioner for Lagos State, he was saying to flatten the curve for this infectious disease, it depends on all of us. And if you see most of the analysts, they keep shouting, we're not testing enough, the corona is not an African disease. Now we have just about 400 confirmed cases, over 400 confirmed cases and 12 deaths. And the NDC just told us that they have capacity to do 3,000 tests. So let's assume yesterday, 3,000 tests was conducted and we have about 30 new confirmed cases. So what it means is that if we have a population, that's almost like 0.1% of the tested number. So it means that by the time we do tests for 200 million people, we'll be expecting about 20 million infected people. And if you look at the casualty, when you have almost 0.14, 12 to 400, you discover that the fatality rate, if you begin to look at the number, is getting increased. Yes. So what I would say is that government has to do what they need to do to ensure that we contain this disease. And unfortunately now, we may say the southwest part, the southeast part are a bit enlightened. Now this disease is eating Kano. And you know the number of Almojiri, how people have been crowded in the north. So you begin to envisage what is the medical facility they have in the north, what is the mortality rate at Chad Bad.
In fact, a recent report came out saying that northern governors are saying that they do not have that palliatives and the capacity to actually address this issue.
I think the challenge is that most of our national dailies try to sensationalize some of the headlines. The northern governors did not say so. The northern governor, what they imply is that they were going to try as much as possible to see how they seek help to ensure that the lockdown will not work. If you say the northern government says no, what happened in Kaduna? They've already locked down Kaduna. What's happening in Katsina? They've locked down Daura for a couple of weeks. Kano State government have locked down as well. Gombe has bringing curfew. So these are northern states. And all of them knows that the Almajiri system in the north, the health facility in the north, the kind of feudalism, the family setup in the north will increase the rate at which this disease spreads. So to say that that's the definitive outcome of the Northern Governors Forum may not be entirely true, because you already have some critical states in the north already locking down their facility.
Taking measures.
So what I would say is that I'm appealing to our colleagues, the elite, the educated one, to stop the campaign of saying COVID is not disease for Nigerians or for Africans. This thing is real. Now, before now, they were doing 100 tests a day. We are seeing 2, 3. We say it's not real. Now they are doing 3,000 tests a day. And we're getting 30. We are now getting double figures.
Yes.
In the last 1 week, it's been double figures: 19, 21, 14, 17, and now 30. So we need to be very, very careful. Knowing fully well, again, Lagos is setting up about 20 molecular testing centers. Federal government is looking at setting up isolation centers and testing one at Nigeria entry point. There is problem on our hands, and the best we could do now is that to observe social distancing, ensure that, look at what happened in Lutz. A doctor in a private hospital treating a patient contacted the disease, and he died. If a medical doctor that's supposed to know, knows how to take care of themselves, ensure that they take the precautionary measure, can fall victim to this COVID. I think the work is on all Nigerians to ensure that no matter how close, no matter how we don't believe all this scientific theory, we try as much as possible to ensure we ensure all the guidelines are stated by PTF and also the NCDC. We are appealing to them. It is not time to look. There was a clip I saw online, American doctor saying the COVID is, if you ask COVID, you should come and ask him. Few months after, we know where he is now. We know where the wife is. We know what the doctors are saying. So I'm appealing to us, don't let us be brainwashed. And again, for some of the international communities, China is a closed environment. So if Chinese government is telling you 5,000 people are dying in China, I can bet it with you, it's over 50 million people that are dying.
But let's quickly look at a particular aspect, because from people saying that COVID-19 is this, is that, and are not really taking the message or the essence of what it's been doing to heart, brings to bear the question of how much we're doing in terms of enlightenment. Are we really making judicious or rather effective use of our community communicators to reach out to people to basically understand and perhaps drum up these messages on a daily for people to always remember that there is something called COVID-19? Yeah,
without missing what I would say, that National Reputation Agency has failed as an agency of government. Like I mentioned a couple of weeks back, that those days of MAMSA, a lot of promos, a lot of jingles, pre this disease and what have you, people are enlightened at their local languages. Now we're just doing a fire brigade approach to ensure that people get the information. It's too late. Now we are aware of this disease ravaging China as far as October last year. What are the provisions we have put in place as a government to ensure that even the last that is killing us here in Nigeria, what are the things we have put in place? So what I would rather say is that I also encourage the media to work more sensitization than breaking the news of death. So we should also be conscious of telling people what and what not to do, to continue to emphasize on that, rather than giving us statistics of number of deaths, number of recoveries. Once we begin to ring this to people's ear, audio and vision stays more rather than the audio. When people see it, you take this measure, you get this. You take that measure, you get this. And again, the idea of saying who are the people that have died, where are the contact person, it is unlike us in Africa to show that this person is diabetic, this person is HIV positive. It is unlike us.
Because of stigmatization.
Stigmatization has to be dealt with as well. So what I will encourage the government to do is that government, like I said, government can employ TVC in terms of sensitization. We can do it for them. Right. We have a radio platform, we have a TV platform, and I'm telling you, if government brings the money, we know what to do and how to do, and we can help them reach the popular audience. And as much as possible, that private media can also assist the government in getting this done, either as CSR or pay services. And I'm sure Nigeria will be better out of it.
All right, Obaniyi Akinwale, we'll leave the discussion at this point. Thank you for speaking with us.
My pleasure.
Time now to take a look at stories making the headlines in Nigerian newspapers. I have in the studio with me in-house analyst Obaniyi Akinwale. Thank you for joining us on TVC Breakfast. Let's quickly head straight to the papers, and I begin with the News Direct. COVID-19, federal government releases 200 billion naira to boost power supply, NNPC. And on the front page of the Leadership newspaper, coronavirus, President Muhammadu Buhari gives presidential task force marching orders to halt spread. On the front page of the Blueprint, lockdown palliatives, states to take charge of distribution, federal government. And to the Daily Trust, Lassa fever killing Nigerians more than COVID-19. 188 citizens died in 3 months. 963 cases in 27 states. Disease deserves more attention. And then finally, on the Daily Times, COVID-19, we can test 3,000 persons daily. NCDC declares. I'd like for us to quickly look at the story on the front page of the Daily Trust. Another issue that is of major concern to a lot of Nigerians, as it has affected almost every state in Nigeria, talking about Lassa fever. For the past 51 years, Obaniyi, we've been dealing with this issue, and in just 3 months, like the paper has said, 188 persons have died, and we have 963 cases in 27 states. Over 51 years we've been dealing with this. How concerning is this for you, looking at the fact that we also have COVID-19 that we are dealing with, not to talk of other cases of malaria and other diseases that we are also handling as well?
Yeah, thank you very much. I will say that what we are facing is what been termed as neo-colonization. Lassa fever is seen to be the disease of the sub-Saharan Africa, especially Nigeria per se. It's a type of rat that create that infection. At the moment, for, like you mentioned, over 50 years, there is no cure. And the question you ask yourself is that, will international organizations or donors or agencies be interested in creating vaccine for something that is not commercially viable? I would say absolutely no. Commercially viable? It is not, because at the moment you said 188 died based on record, 93 infected. You ask yourself, why will Chinese government, Jack Ma Foundation, Chinese Engineering Construction Company, everybody, United States, Melinda Bill Foundation, interested in COVID, and we are not interested in Ebola? You ask yourself those questions, and you find out that the interest is more in what do we need to gain. I will tell you one. Chinese engineering construction companies handle virtually all Chinese-funded loan in Nigeria, which means either directly or indirectly, you are employing Chinese people on the shores of Nigeria on loan paid by Nigeria, which is being used to pay their salaries. Yes, they are developing infrastructure for us. Now, if you now say COVID will not allow CECC to finish up their project in Nigeria, what is the impact in terms of employment generation for the Chinese? What is in terms of moratorium or loan repayment on the Chinese? Now ask yourself, what impact will such have when we are talking about Lassa? Because you ask yourself, what is the mortality rate of Lassa? What is the commercial viability for them in Lassa? And is where their interest lies. So the challenge we have is that it is high time Africa begin to look at African solutions.
And that is where I'm going to, that at this point, as the giant of Africa that we say we are, shouldn't at this point we have come up with certain solutions? Because when you look across the world, there is nowhere you wouldn't see a Nigerian when it comes to the health sector championing one cause or the other. Is it so difficult for them to perhaps put heads together, or for us to put heads together and say we need to find a solution, looking at the number of deaths we have recorded?
Yeah, carelessly one of our minister said we have more than enough doctors to do our work. And I recall vividly as well, as much as I agree that sometimes our unions go beyond bounds. NMA, ASU have several times said, if you go to our universities, you discover that at this modern age and time, you will still find pendulum as the experiment. You go to our WAEC exam, you see people still using vernier calipers, rulers, and what have you. You discover that people still go back to use Abbott or physics of 1970s and see those old units. When the modern world are looking at how do we begin to infuse artificial intelligence, you see academic curriculum in primary, secondary school, and even in university, it is not modern day, it is not trending. So if you look at it, what happens at our R&D Institute and Nigeria as a whole is a reflection of our society. We have failed and we have continued to fail in investing in R&Ds. So when you say we have Nigerians, find out South Africa is trying to always take our best brains to South Africa. Now ask yourself, how many brains are we attracting to this country? Where are those laboratories? Prior to COVID, we only have 5 laboratories in Nigeria, out of which some of them are private. So if, as a whole, infectious disease laboratory in Nigeria is only one, what has been the record of NIMR, Nigerian Institute of Medical Research, in terms of diseases, and what have you do? You mentioned 50 years. If in 50 years, NCDC, NIMR, and some agronomy in EDE cannot come up with a solution possibly to eradicate the rats, or possibly to vaccinate people, or possibly to increase the immunity against death from Lassa, you ask yourself, then when are we going to do it? And like I said, why do we require to call Bill Gates and what have you to come in? Why they are coming is because Africa is commercially viable. Nigeria has a population of 200 million. It's, like they said, it's just they have a virgin land, you have the resources and what have you, and they can explore. But what are they going to explore from Lassa? 188 people, just less than, like a clip we said that they're going to make about 40 million vaccines. So what amount of vaccines are going to provide? What's going to provide for the industry in the US? Americans or Chinese or any other European government, let me put on record, will not do anything that will not fetch them massive returns. And that is why we are where we are. We are appealing to the government. It is high time, quoting Governor Sheyi in this word, that we begin to look at local solutions. We have identified these rats. How do we eradicate them?
Yes.
How do we ensure that bush burning does not push these rats to our houses? When they said the white blood cells from COVID, from a carrier that has been already certified negative, can be used to treat another patient, are we looking at exploring those people? Has anybody recovered from Lassa? Are we looking at how do they recover? What is the benefit? What is going to happen to their white blood cells? And how we can use it? We have brain in this country, but they are handicapped because there is no laboratory, there is no facility, there are no reagents, there is no motivation even to do what they need to do.
Obaniyi Akinwale, so much to talk about with regards to this. Thank you for speaking with us.
My pleasure.